Hi, welcome back to my Diaries video channel. Today in this session we are going to cover the nose and the paranasal sinuses with past essay questions. So this is a brief outline of today's topic: external nose and the nasal cavity. Okay, first let's talk about the nasal cavity, then later we can discuss the external nose. So we have to discuss roof and the floor, medial wall, lateral wall, and I'll get an approach to each of those topics through a clinical scenario. Then I'll explain the clinical condition, and with that I can discuss all the gross anatomical points relevant to that topic. So let's begin. So here you have the lateral wall of the nasal cavity. And this is the medial wall of the nasal cavity, or otherwise we call it medial nasal septum, which is going to divide your nasal cavity. And I can show you the roof like this and the floor of the nasal cavity like this. Following a road traffic accident, a man was admitted to the ward and found that his cribriform plate of ethmoid bone was fractured, causing CSF rhinorrhea. In this condition, the cerebrospinal fluid is coming through your nose. Cribriform plate is this horizontal plate in the roof having some holes for the passage of olfactory nerve rootlets. And so olfactory nerve rootlets arising from olfactory mucosa. And here you have the olfactory mucosa. And the upper 1/3 is lined by the olfactory mucosa, including cribriform plate, medial and lateral wall up to the superior concha level. So this olfactory nerve is involved in conveying special sensory information related to smell. Here in this picture you can see the olfactory nerve rootlets going through the cribriform plate and together form the olfactory nerve on the ethmoid bone. So the pressure applied during the road traffic accident on the ethmoid bone may tear off the dura mater of the olfactory nerve rootlets and open the subarachnoid space. So the clear fluid in the subarachnoid space called CSF has come out to the nose. So this is the type of clinical scenario you get, and to understand how this happened, you should have an idea about the gross anatomy of the nose. The roof of the nasal cavity, and this is the floor of the nasal cavity. As shown in the diagram, roof is made up of three bones: the horizontal part by the cribriform plate of the ethmoid bone, and anterior slope by the frontal bone, and the posterior slope by the sphenoid bone. And the floor is made up with palatine process of the maxilla, this red color one, and the horizontal plate of the palatine bone, this blue color one. Now let's see the medial wall of the nose with a clinical scenario. A boy admitted to the hospital with nose bleeding, or otherwise we call it epistaxis, was diagnosed that the blood vessels are damaged in the Lateral area. What are the bones and cartilages forming the medial nasal septum? Medial wall, or otherwise we can call it medial nasal septum. Medial wall is a partition between two halves of the nasal cavity. On each side it's covered by mucous membrane. This wall is also an osteocartilaginous partition which is formed by bones and cartilages. So this septal cartilage you can see, and the perpendicular plane of ethmoid bone and vomer bone. Blood supply of the medial nasal septum. So you can see anterior ethmoidal artery and the posterior ethmoidal artery coming through the ethmoid bone and supplying the medial nasal septum. The sphenopalatine artery coming through the sphenoid bone and supplying the wall. And you can see here the great palatine artery coming through the incisive canal into the nasal cavity from the oral cavity. And here you have the septal branch from the nasal artery from the superior labial artery. In 2010 proper examination, they have asked to write a short note on Little's area. So if we divide the nasal septum into four areas like anterior superior, anterior inferior, and the posterior superior and the posterior inferior, In anterior inferior part of the medial nasal septum, you have this Kieselbach plexus. So this Kieselbach plexus is formed by the anterior ethmoidal artery and the sphenopalatine artery and the greater palatine artery and the septal branch from the nasal artery of the superior labial artery. So here we have a rich blood supply. This little area is a common site for nosebleeding, or otherwise we call it epistaxis. Nerve supply to the medial nasal septum. So you can see the septal branch of anterior ethmoidal nerve and the posterior ethmoidal nerve, and here you have nasopalatine nerve, and here you have the greater palatine nerve, and here the anterior superior alveolar nerve. Venous drainage of the medial nasal septum. From Little's area, venous drainage to the fascial vein, and from the sphenopalatine vein, the venous drainage is to the pterygoid venous plexus. Lymphatic drainage of the medial nasal septum. From posterior half to the retropharyngeal nodes, and from anterior half to the submandibular nodes. Now let's see a very important topic. A girl admitted to the ward was diagnosed as maxillary sinusitis, developed from a caries tooth, and the drainage of the sinus is difficult because its ostium lies at a higher level than its floor. Hence, the sinus is drained surgically by making an artificial opening near the floor by an antrum puncture. So you can see in this picture, the maxillary sinus ostium lies at a higher level than its floor. In this antrum puncture, what do? They break lateral wall of inferior meatus and push in a fluid and let it drain through the natural orifice. To deal with this type of clinical manifestations in future, you should first have an idea about the lateral wall of the nose and the sinuses. So you can see the nasal bone here and the frontal process of maxilla and lacrimal bone and ethmoid bone forming the superior concha and the middle concha. And here the inferior concha is an independent bone. It's a kind of spongy bone, and this blue color one perpendicular plate of palatine bone and medial pterygoid plate of sphenoid bone. So in the lateral wall you have shelf-like projection into the airway, otherwise you can call them turbinates, and concave increase the surface area of the nose for effective air conditioning of the inspired air. And you can see the lateral wall separate the nose from above orbit and intervene ethmoidal air cells, and below the maxillary sinus and front nasolacrimal duct and lacrimal sac. So meatuses are the passages beneath the concave. Let's see. This is a cross section through the coronal plane, and you can see the superior concha. Under cover of it you have the superior meatus and middle concha. Under cover of it middle meatus and inferior concha and the inferior meatus below. List out the structures in the lateral wall of the nasal cavity. In 2010 proper examination they have asked this question. If you remove these concha, you can see the superior meatus below, middle meatus below the middle concha and the inferior meatus below the inferior concha. Other than that, you have sphenoethmoidal recess here, and sphenoid sinus opens into the sphenoethmoidal recess that is situated above the superior concha. So let's see the blood supply to the lateral wall of the nose. So if we divide the lateral wall into 4 quadrants, you can see the posterior superior part by the sphenopalatine artery and the posterior-inferior part by the branches of the great palatine artery, and the anterior inferior part by the branches of fascial artery, the anterior superior part by the anterior ethmoidal artery. So, external nose is an osteocartilaginous framework. Why do we call it so? because it is made up of bones and cartilages. Other than bones and cartilages, nose owns some muscles too. So let's have a look on bones, cartilages and the nasal musculature, which are going to form your external nose. So this is the side view of external nose. To elaborate, upper 1/3 bony part and lower 2/3 cartilaginous part. So this bony part is made up of two bones. One is the nasal bone, while the other one is the frontal process of maxillary bone. And lower 2/3 cartilaginous part, you can identify the septal nasal cartilage lateral process and U-shaped major alar cartilage here and the minor alar cartilage. And the free lower border of the nose is solely made up of free fatty tissue, so we call it alar. Procerus muscle and the levator labii superioris muscle, when they contract, they elevate the nose. And the alar part of the nasalis muscle together with the depressor septi muscle depress the nose. And the nasalis muscle transverse part together with compressor naria minor, they compress the nose. And the dilator naris muscle aids in the dilating. So this is the brief outline of the nasal musculature. You have elevators, depressors, compressors and dilators. Now let's see the paranasal sinuses. An old woman complains of a severe headache with persisting thick purulent discharge from the nose, and a radiograph taken in the investigations shows radio opacity. So you can see the frontal sinus, sphenoid sinus, ethmoidea cells and the maxillary sinus. We are going to talk about these four sinuses. So the frontal sinus closely related to the frontal lobe, so the infection may result in the frontal abscess. So you can see the frontal sinus here and the frontal lobe is here, so there is a close relationship, so infections may result in frontal abscess. And CSF rhinorrhea may occur. And ethmoidal sinus, this is related to the frontal lobe. This may result in frontal lobe abscess as we discussed earlier, and CSF rhinorrhea may occur. Sphenoid sinus drains above the superior concave and sphenoethmoidal recess, and the pituitary gland may be excised through the fiber optic transnasal transsphenoidal approach. And the maxillary sinus, its pyramidal shape, it is situated within the body of the maxilla, and opening is inefficient because opening is superiorly placed. It only drains the apex, so it is inefficient, and the floor separated from upper premolar and molar teeth by only a thin layer of bone, and the dental roots project into the sinus. And the maxillary sinus carcinoma is a common clinical manifestation. And the posterior ethmoidal sinus opens into the superior meatus here, and the sphenoid sinus opens into the sphenoethmoidal recess, and the frontal sinus, maxillary sinus and the anterior and middle ethmoidal air cells open into the middle meatus. Let's talk about the middle meatus further. The middle meatus, you have hiatus semilunaris and the ethmoidal bulla. So the frontal sinus and anterior ethmoidal air cells and the maxillary sinus open into the hiatus semilunaris, and middle ethmoidal air cells open into the ethmoidal bulla. So in the gross spot you may get the middle meatus, hiatus semilunaris, inferior concha, sphenoethmoidal recess, and the maxillary sinus here, and sphenoethmoidal sinus.